Hi there, I'm Kelly Harper. I'm the Manager of Disease Surveillance here in Animal Biosecurity at PIRSA. Next slide, thanks. So now is the time to start considering what policies your clinics will implement should the new clade of HPAI be detected in Australia, or even any strain of HPAI. It's really important to consider your clinic's capacity to reduce the potential spread of avian influenza if you do elect to receive and treat sick birds. Decisions should be made on sound evidence and from trusted resources, and I'm going to share some of those with you now. I'm going to touch on the key risks associated with the new clade, some in-clinic biosecurity planning, and some information for wildlife carers and pet owners. And as mentioned, following the webinar, we'll send out an email with a list of all of the resources mentioned so that you can start planning and be well prepared in your own clinics. Thank you. So it might feel overwhelming to think about the potential impacts should the new clade of HPAI be detected here in South Australia. And the reality is owners of pet birds and backyard poultry will continue to seek veterinary care and advice from you. And you will continue to be presented with sick and injured wildlife by members of the public. This really is an unprecedented time, and across state and federal government, there is a lot of preparedness work underway, but we don't yet have all of the answers. So in the face of uncertainty, it's important to focus on what we can control. And in terms of private veterinary practice, this is planning for and developing procedures to prevent the likelihood or reduce the likelihood of introduction of virus into your clinic. And if you did happen to have a case, be able to reduce its spread. So the way this is going to be managed will be different for every clinic, and it'll be based on your own individual circumstances, your clinic's facilities, your capacity, your risk tolerance, and your patients. Next slide. So now I'm going to touch on some relevant risks for consideration, especially with regard to the new clade. So as mentioned already, the risk to human health of the new clade is currently considered low, but it is still really important to be wearing appropriate PPE, as is good practice anyway. So at the minimum, eye protection, mask and gloves. Health authorities are recommending that people who handle birds remain up to date with their seasonal influenza vaccinations. While these won't prevent infection with avian influenza, they will reduce the risk of becoming infected with both seasonal and avian influenza at the same time, which is considered really concerning in terms of the virus's ability to recombine and the potential for a new human pandemic. In terms of healthy pets and wild animals, if your clients have backyard poultry that have access to outdoors, which will be most, I would imagine, they're potentially at risk because they may have contact with wild birds and be exposed to virus. Native wild birds, as Alyssa's already been through, may be in contact with the migratory seabirds and possibly marine mammals, and they often have common congregation points. And then also, as Alyssa mentioned, the wild mammals, the scavengers that will feed on sick and dead birds or other animals. So this will include things like our sea lions, but also introduced animals like cats and foxes. And then finally, thinking about your own patients, whether they're inpatients or outpatients, and is there any potential for exposure to virus if you happen to have sick or wildlife or domestic species at your clinic? Next one, please. So there are some really excellent resources that are publicly available that will assist you in developing an in-clinic biosecurity protocol that is both practical for your staff and your clinical facility. And we really recommend that you start thinking about this now so that you're prepared if the new clade or any form of HPAI occurs in South Australia. As mentioned, I will share the links to these resources with you afterwards, but just a couple of examples. The AVA have guidelines for veterinary personal biosecurity, and in that document there's a template that you can use for a clinic infection control plan that you can adapt to your own clinic. Then the New South Wales Department of Primary Industries released a really great document targeted at private vets and specifically with regard to avian influenza. And I really recommend that you do access this document and read it. The 4 dot points here are summarised from that document, and they go through all the things to be considering. So these include triage procedures prior to arrival. So what are you going to train your staff to say on the phone when they receive phone calls about sick birds or wildlife? Can you minimise the risk of HPAI spread through isolation and biosecure workflows? Do you need to develop entry and exit protocols into an isolation ward, perhaps? How are you going to manage suspect cases in the clinic, including how you will undertake testing? Then, of course, personal protective equipment is so important. What do you need to have on hand? Do you need to train your staff and ensure they're familiar with the protocols? And decontamination and disinfection of personnel and the environment are so important, as is waste disposal. And finally, if you make the decision that you're not confident in your ability to manage the risk of HPAI in your own clinic, where are you going to direct your cases to? Should people phone up wanting their birds seen? Are there other clinics in the neighbourhood that are willing to take them? That's all to be thought about. Next one, please. So this is a lived example. It's a recent webinar, and again, we'll provide the link afterwards. And it highlights the planning, preparation and procedures required to successfully isolate and manage sick birds with suspected or confirmed HPAI in a rehabilitation centre in the USA. The whole webinar is really informative and well worth watching. The section by Dr. Victoria Hall gives applied information regarding their clinical experiences, and it starts at the 15-minute mark, and I'd really encourage you to watch that one. Next. So in the event of HPAI occurring in South Australia, and this is most likely, again, focusing on the new clade, we will be recommending the following advice to fauna carers and pet owners, and we'll be encouraging you as private vets to be doing the same, because you'll be fielding queries. So I guess it's worth becoming familiar with avoid, record and report. So first of all, people should avoid contact with sick or dead wildlife and their environment. In particular, they shouldn't allow pets to touch or eat sick or dead wildlife. We won't be encouraging people to be handling dead animals. However, if that's required, good hygiene measures will be definitely recommended. Next up, people coming across sick or dead wildlife should record what they're seeing, what type of animals they are, the numbers, the location, and ideally photos or video can be very helpful. And finally, reporting any unusual sickness or mass mortality events in wildlife via the Emergency Animal Disease Hotline on 1800 675 888. And that actually applies right now too. There's an excellent fact sheet from Wildlife Health Australia called Advice for People Who Encounter Sick or Dead Wild Birds, and it's applicable to fauna carers. Again, we'll link it in the email we send out, and it's a really great resource for you. We also have a PIRSA wildlife webpage for sick or injured wildlife, and we update that as needed. So again, we'll link to that later. Next one. So finally, avian influenza is a notifiable animal disease. This means you must report if you've got reasonable suspicion that disease could be due to avian influenza. If HPAI is detected in South Australia, we will issue an email biosecurity notice via the Veterinary Surgeons Board, and we'll also update our webpage. So again, we'll provide the link, and I'd really recommend that you bookmark the webpage. The things that we would like you as private vets in South Australia to be doing now is planning, watching, and reporting. So in terms of planning, as I've gone through, start thinking about and developing a biosecurity protocol that's suitable for your practice, and ensure your staff are familiar with it and trained where appropriate. Stay up to date with current information, and again, stay with those trusted resources. So some examples include the PIRSA website. Outbreak.gov.au gives more information about sort of a broader picture within Australia, and Wildlife Health Australia is a great resource too. And then watch. So we've been through what signs to look out for in terms of HPAI, and finally report. So I'd really recommend, if you don't have the EAD hotline number in your phone, that you save it in there now. It's much better to have it in there ready to go, so you're not panicking if you need us. It's okay to call us if you're not sure, because our role here is to provide you with support.